Okay, so ready for a deep dive that might actually change how you view going to the dentist.
Hmm, I like that.
We're not just talking pearly whites today, though, right? It's way bigger than that.
Right.
You've been looking into periodontal disease, and I gotta say, some of this stuff is seriously eye-opening.
Yeah.
Get ready to become like a gum health detective.
I like it.
All right, so we're going way beyond just bad breath here. Your notes mention gum disease, like increasing your risk of heart disease.
Okay.
How are those two things connected?
It's pretty wild, actually. When you have gum disease, your gums are basically fighting off infection all the time, so they're inflamed. The thing is that inflammation, it doesn't always stay put. It's like, imagine your bloodstream is this highway, and all these inflammatory molecules are tiny little troublemakers hitching a ride. They can actually travel throughout your body and cause damage wherever they end up.
Okay, that is kind of alarming. So, like, the inflammatory molecules from my gums can actually mess with my heart?
They can. They can contribute to that plaque buildup in your arteries, which we know increases your risk of heart disease.
Right.
And it's not just heart disease either. Studies show links between gum disease and other things you might not expect: diabetes, even breathing problems.
I had no idea it was so serious. It's like a domino effect through your whole body.
Yeah, pretty much.
Okay, so you mentioned stages of gum disease in your research. Is it like a slippery slope, or are there clear signs at each stage?
It's easy to miss the early signs, which is why we really need to break down how it progresses. Typically, it starts with gingivitis. So your gums might be a bit irritated, maybe a little red or swollen. You might even see some bleeding when you brush.
Gotcha. So those are those early warning signs, subtle clues that something's off.
Exactly. The good news is gingivitis is reversible. Good cleaning from your dentist, tweak your routine a bit, and you can usually get rid of it.
That's good to know. But what happens if you just ignore those early warning signs?
Well, that's when it can turn into periodontitis. And that's where the real damage starts. The infection goes below the gum line, and you get these pockets forming between your gums and teeth.
Pockets.
Yeah, and those pockets are basically hiding places for bacteria. And as they get deeper, they can actually start to eat away at the bone that supports your teeth.
Wait, bone loss? Seriously?
Yeah, it's serious stuff. We're talking about the foundation of your teeth here.
Yeah.
This is why those regular dental checkups are so important that dentists can catch these problems early on.
Okay, this is a lot to think about. So we know gum disease is bad news, but what are some specific signs people should watch out for?
Well, like we talked about, bleeding gums are common early on. But there are other more subtle signs, too. Pay attention to your gums color.
Okay.
Healthy gums should be a nice pink color. If they start looking really red or even kind of purplish, that's inflammation.
So red or purplish gums not good. What about how they feel? Anything there we should watch out for?
For sure. Healthy gums should be firm and snug, right around your teeth. If they're swollen, puffy, tender when you touch them, yeah, that's another sign something's up.
Okay, so look and feel. Got to pay attention to both.
Exactly. And another one is really bad breath that just won't quit. Everyone has bad breath sometimes, but if it's chronic, it could be gum disease.
Makes sense if those pockets are like little bacteria farms.
Right. And then there's gum recession. Have you noticed your teeth looking longer? Like your gums are pulling back?
Maybe a little. Is that something to worry about?
It can be. Gum recession means the roots of your teeth are exposed, which can make them really sensitive to hot or cold stuff. Makes them way more vulnerable to decay, too.
Okay, I'm adding checking for gum recession to my to-do list. So we've covered some visible signs, but you said what's happening below the surface is critical. Let's talk about those periodontal pockets. How do those even form, and why are they so bad?
So as that infection gets worse, the space between your gums and your teeth gets bigger.
Yeah.
That's how those pockets form. Now imagine trying to clean a tiny little crevice with a toothbrush.
Yeah, good luck with that.
You can't really clean them well enough with regular brushing and flossing, so plaque and bacteria just build up in there.
So the deeper the pockets, the harder they are to clean, and the worse the infection gets.
Exactly. And as those pockets get deeper and deeper, your gums can actually separate from your teeth entirely.
Yeah.
And, well, you know what happens then, all right?
Tooth loss, not good.
Not good at all.
I'm definitely going to floss tonight.
Okay.
But seriously, this is important stuff. Knowing the signs and how this disease progresses can make a huge difference in catching it early. So let's say someone's listening and they're thinking, uh-oh, I might be a little past those early warning signs. What are their options?
That's a great question. And honestly, even if gum disease has progressed, it's not hopeless. We've got some amazing treatment options these days, but we'll get into that after the break.
All right, so before the break, we were getting into some serious stuff. You're saying there's hope even if someone is showing signs of gum disease?
Oh, for sure. Dentistry has actually come a long way in how we treat gum disease.
Okay, well, now I need to hear about these treatments, especially for not just scraping anymore.
Right. Well, one of the coolest things is laser therapy.
Lasers, like in my mouth. I'm a little scared, but tell me more.
It's not scary at all.
Hmm.
Basically, these lasers are super precise, and we can target that infected tissue in the periodontal pockets without bothering the healthy gums as much.
So less damage overall, that's good. How does it compare to traditional surgery?
It's way less invasive than traditional surgery, less pain for the patient, faster healing, and usually even better results.
So less pain, quicker recovery, and it works better what's not to love. But what about those cases where there's already some bone loss? What do you do about that?
You're right, bone loss is a big deal. But even then, we have some great options. One of the most amazing things is bone regeneration.
Wait, bone regeneration? Like regrowing the bone? How does that even work?
I know, it sounds crazy, right? But with bone regeneration, we can use the body's natural healing to actually regrow that lost bone tissue.
Okay, but how? What is this magic?
Not magic, but close. We use these special materials like membranes, grafts, or proteins that are put where the bone loss happens.
So what do they do?
They're basically like a scaffold. They support and guide your body's own bone-building cells and encourage them to grow back in that area.
So it's like hitting reset on your gums and bones? That is incredible. Can everyone get this treatment?
It's not for every case, but it's a real option for people to get back a healthy smile and not lose their teeth.
That's amazing. It's like we've moved on from just treating symptoms and are actually fixing the root cause and regenerating things. Okay, let's bring it back to the basics now. We talked about prevention, but it's worth going a bit deeper. What are the most important daily habits for good gum health?
You're right, prevention is key. And the good news is we have a lot of control over it.
Give me the secrets.
It's all about good oral hygiene, brushing twice a day, 2 minutes each time, and make sure you're getting every part of your teeth, even your tongue.
I'll admit, I don't always clean my tongue. Should I be?
Definitely. It's a breeding ground for bacteria. Don't forget to scrub it every time you brush. And speaking of scrubbing, flossing is non-negotiable.
Please don't tell my dentist, but I actually like to floss.
Well, like it or not, it's the best way to get rid of the stuff your toothbrush misses. Think of it as preventative maintenance.
Gotcha. Brushing, flossing, check and check. Anything else?
A good mouthwash. Find one with antimicrobial properties that can help with plaque and gingivitis.
Not all mouthwashes are created equal then.
Nope. And last but not least, regular dentist visits.
An ounce of prevention is worth a pound of cure, right?
Exactly. Regular cleanings get rid of tartar, which you can't do on your own, and your dentist can find early signs of gum disease.
It's like having a personal trainer for your teeth. They keep you accountable. So we've covered prevention, what happens if you ignore those warning signs, and even some amazing treatment options. Before we wrap up, I want to come back to that connection between oral health and overall well-being that you mentioned earlier.
Absolutely. It's really interesting. We know now that gum disease isn't just a problem in your mouth. It can affect your whole body.
This is about way more than just bad breath, right?
Way more.
Right.
Remember those inflammatory molecules we talked about? Research is saying those might actually play a role in a ton of different diseases. Heart disease, stroke, diabetes, respiratory problems, even problems during pregnancy.
That's a lot. So taking care of our gums, that's about more than just keeping our teeth. It's about our hearts, our brains, our whole body.
Exactly. It shows how connected our bodies are and how things that seem unrelated can actually have a huge impact on each other. Oral health is not something to mess around with.
It really changes how you think about the phrase healthy smile. So is there anything else our listeners should remember about this connection? It really makes you think about how you treat your mouth, huh? This whole connection between our mouths and the rest of our bodies is pretty wild.
Right. We often think of our mouths as separate, but it's all connected.
It's like we've been selling those pearly whites short. So as we wrap up, what's the one thing you really want our listeners to remember?
I want everyone to understand this. Your mouth tells the story of your overall health. Taking care of your oral health isn't just about a pretty smile. It's about taking care of your entire body.
I love that the mouth as a mirror for our health. So remember, brushing your teeth, that's about more than avoiding cavities. It's about a healthier heart, a healthier brain, a healthier you. Okay, before we go, one last thing to think about. Imagine a world where dentists could tell you your risk for heart disease or even Alzheimer's just by looking at your gums.
Wow, that's interesting. And maybe not that crazy given everything we've learned about how oral health and other diseases are connected.
Exactly. It seems like we're just starting to understand what our gums can tell us. Who knows what other amazing things we'll learn about dentistry in the future? Until next time, keep up with that brushing and flossing and keep those gums healthy. Your whole body will thank you.